Hi, I'm Dulcie Hill, and today I want to talk about what do neurologists want to hear from their MS patients. I recently went to a seminar, and this wonderful MS neurologist was telling us what she wants to hear as a doctor, and I took some notes down. First of all, neurologists want to know each symptom someone has that they cannot tolerate, and they want to control them. A lot of us have symptoms, but we don't want them controlled. Or, for example, if a person has no muscle strength in their legs and relies on spasticity, or overtone, when you're so rigid there, and you use that to stand, you may not want to take baclofen or the medications, Botox, to treat that. Personally, I have that terrible burnt skin problem on my legs. When I sit down, it feels like it's ripping apart there. It only lasts just for when I sit down, and it goes right away. I've been often offered gabapentin or Neurontin for this, but the side effects, anybody who's on that, makes you dizzy and sleepy. And why, for me, it wasn't good enough to ruin a 24 hours on a medication for a 1 second or 2 second split, pain. So I don't want that to be managed. If I didn't say anything to the doctor and I said, except I have spasticity, I have got burning legs, cold feet, yada yada, she might want to treat it all. So it's important to tell them which symptoms you can't tolerate. Here's some examples of symptoms you may have that you can't tolerate. So write these down when you go to your neurologist. Intolerable symptoms that can be treated: fatigue, insomnia, spasticity, depression, foot drop, incontinence, slurred speech, pain, sexual impairments, and again, you can improve your walking or improve your strength or how to move mobily by asking for physical therapy or occupational therapy. Again, only bring up the symptoms you want help treating. Ask for a prescription. If your neurologist wants you to try medication, only ask for, say, small trial dose. So ask for 2 prescriptions, one for, say, 5 days, or just to determine if you like it and it's effective. And the second one is the larger amount, maybe the whole month or 3 months, however you do it. But you're not going to use that if you can't tolerate it. So it saves you some money that way. Next thing, doctors want us to be prepared to ask questions about disease-modifying medications that we're interested in taking. If you go unprepared, you'll be assigned a medication that the doctor thinks is best. Now that takes everything away from you. And again, if you go in and you say, all right, doctor, tell me all the medications, what are my options and all. Well, there's so many medications that the doctor is going to be talking about you behind your back when you walk out, because it takes up all their time and it doesn't make your appointments meaningful. So what do? First, how do you prepare? You go to msfrontiers.org or the MS Society. Although if you go to msfrontiers.org, click the tab that says medications. On the left is the medications listed in the order of effectiveness. Write down these three medications and research the heck out of them. Join MS Frontiers Medical Support on Facebook. I said that. And ask the 1,800 people with MS their experience on that medication, as well as the negatives. I was going to read off the medications and the effectiveness, but I don't want to spend that much time bothering you. So between the least effective is Copaxone, the most effective is Tisabri, and there's not enough information on Ocrevus or rituximab right now. All right, third thing you're going to ask your doctor about the risk and reward about these three medications you're bringing up. All medications have side effects. So it's important to ask the doctor what the plan is if you should have a really bad thing happen. Suppose you're taken to Sabri and you're concerned about PML. And you bring that up and you say, yeah, doctor, I like that, but what happens if I get PML? Instead of saying what happens, ask your doctor how to detect it, how you're going to detect it, and then ask the doctor, what is your plan for managing the PML I get? I need to know the protocol there, right? And also, a lot of other medications have scary medical situations that can be reversed. Liver problems or kidney problems and can easily be reversed. So ask your doctor, oh, I see that this could increase my blood sugar, or it could, my thyroid, it could injure my thyroid. What is your plan, doctor, if that happens? So you're in a position of power. The planning will make the most of your appointment. It'll earn your doctor's respect as a team player. So you're managing this disease with the knowledge you bring to the doctor. The neurologist is one part of it. You're one part, and I just think you ought to go to msfrontiers.org and join one of the Facebook groups that apply to you. Join them all, and use that as your third tool for your management team. Because I'll tell you what, since I've involved everybody with MS in my MS management team, it is I feel so confident, and I want you to feel that too. Anyway, it's a long video, sorry about that, 7.5 minutes. God bless you. Go to msfrontiers.org. Please subscribe. I pray for all of you. Remember, God bless the thorn I have in my side that has made my life so much better because of this disease. And I want you to have that too. I pray for you. God bless you. Keep coming back.